Is the top 7 sabotaging habits that keep you feeling meh about taking action to get healthy. I'm Dr. Vera Singleton. Thank you for joining me. This is going to be a really informative and quick way for you to drill down at the top of the new year on how you can stop doing the things that are really getting in the way of you taking action. A lot of times people feel like they're so excited. It's the New Year's resolutions, and especially this year, you probably have a lot of resolutions just to make sure that what happened last year doesn't happen again. But what are the things that's going to keep you blocked and keep you from not being successful? So a lot of times you may just not want to go to the doctor. Like you may just want to handle things yourself, and that's totally fine. 65% of Americans feel the same way as you might feel, right? You don't want to go to the doctor unless it's absolutely necessary, right? So provided the copay is reasonable and, you really like your doctor, you'll go. But most people will wait for really significant symptoms to pop in. Most people on average, when they come into my office, have been dealing with the issue for at least 6 months, if not 1 to 2 years. Is that you? Have you been waiting and trying different things on your own and not really getting to the success, getting to the level that you want, getting the relief that you want? If so, then you're in the right place. I'm going to show you exactly what you can do. I'm Dr. Vera Singleton. I help people to uncover annoying chronic health issues that keep coming back. If you've tried something, if you've done your research and it works, but then it doesn't again, you got to get to the bottom of the issue. I have a great track record. My Google reviews and my Yelp reviews speak volumes about the work that I do for people. And this is because I use health programs. I am a program manager by training. That was my first career. And I know that as a project manager, when you have a big 10,000 foot view about where you're moving, you can get really efficient with the kind of resources that you spend, the time that you spend, and of course, the effort. Changing health habits is probably one of the most difficult things that you can do in your life. And fact of the matter is, you're listening to an expert. I'm at the top of my field. I've been voted best doctor of the East Bay. I've been recognized with several awards. I speak in the community very frequently. I help you to uncover what's bothering you, and it's gotta be something that's really been on your nerves. Otherwise, you'll just keep pegging away at it. You'll keep looking for it through research. And how I drill down in my programs is through 4 big categories. I have a digestion and gut program which really gets to the bottom of leaky gut issues or food allergies. If the food just has not been sitting well in your body, this program is right for you. If you have issues with your adrenal or your thyroid gland, or it's just not being managed well, or you're perimenopausal and just hot flashes, the symptoms are crazy, your hair's falling out, like all these things are happening and you're not really clear, the hormone restoration program is for you. If you've been dealing with skin issues, especially acne as an adult, that's no bueno, right? That should not be happening. That's a telltale sign that your internal environment is struggling. You need to get that in line. And especially if you have eczema and psoriasis, absolutely. You have to do the internal work. You cannot just depend on topical steroids and antibiotics and Humira for the rest of your life. That's not a viable option. It's got side effects. And last but not least, the burnout recovery program has probably been the most popular of 2020. And guess why? People have been burning the candle at both ends. It's been really, really stressful for a lot of people. And I'm seeing tremendous issues, complex issues, all unfolding together. Sleeping issues and stress binge eating and weight gain and pain flares and all of these symptoms sort of confluing together. This is the burnout recovery program. People who go through this program or these programs in general have great success. So let's dive in. Here's the number one belief, the number one sabotaging habit that's going to keep you locked in. And that's this negative belief that's keeping you from healing. You might have this epic story about why you can't do anything and how you've tried everything and nothing works. I'm telling you that you haven't tried everything. I get a huge number of referrals from other clinicians when patients have hit the wall and there's no other options and have tried all the supplements, and they bring in bags of supplements to me, and I really do a 10,000 foot view and I take a look at what's missing, because there's always something missing in a case. But do you have this epic story that you're living by, that you're just squeezing by, and that's keeping you locked in to the reason why you can't break through, why your habits still stay the same? Number two, you may not have healthy examples surrounding you that can tell you 1,000% when you have someone, a role model, or something that you're looking forward to or looking to, you absolutely have 1,000% more success, right? It's like you have someone else, you see that and it get you inspired and that feels really good. And you're like, I can do that too. You know what I'm talking about. That's happened to me. That's happened to a lot of my clients. And that's how they end up. They hear success stories and that gets them really excited. So you have to have the tools around you that make a difference with being successful. Now, you want to build an incredible castle, an incredible body that's optimal and it's fruitful and it's ready to do all the things that you want to do in your life, to be pain-free, to be sleeping well, to have good energy, right? But you have to have these things in place around you. This is one of the things that I help you establish in my program. Now, number three, you have to have a strategy. Not having a strategy is a game killer. Absolutely. Just imagine setting up a chess piece, a chessboard, and you don't have your strategy in place. You're just going to move your pieces, right? Does that make any sense? You're bound to lose in 6 or 7 moves. Maybe not that quickly, but you get the point, right? Are your habits going to win, going to surpass you? Your habits have a strategy. They're locked in. They've got the emotional eating piece. They've got stress on their side, right? What are you going to do? What are your habits that you're putting in place to beat those bad habits? Who's going to win, you or the bad habits? And if you definitely have your strategy, you do all of this work, what if you're not practicing it? What if you're not implementing it? That by far is wasteful to you. You spend all that time and energy and money to have someone plan a vision for you and then you don't follow through. What is that? Is that part of your story that you're digging into, that you're holding on to? Or is it really something that's blocking you? You really don't know how to move forward. And I can help with that. Sometimes it just feels really overwhelming to take the steps needed to start, right? The first step, or even the second step, or even sometimes you get a little inertia, you lose your momentum. And so you need a cheerleader. You need somebody that can help you to move forward really, really powerfully. Number 5, you may not have a clue about what your body needs. And I'm telling you, that's a number one sabotage. This by far is the number one reason why folks end up in my office and they have their primary care run their annual labs for them and they get a clean bill of health and you still feel crummy. Is that you? Does it sound familiar to you? You have to get a sense of what your body needs. This is a perfect example of someone who had tremendous digestive issues. How are you supposed to know? What can you do? You can't eat more fiber on top of this. This is inflammation. What about this? This is classic IBS, right? Bacteria, imbalanced microflora all over the place. This by far is a sabotage. And there's no way that you would know this unless you get critical testing. And even with your energy, with sleep, look at this, how peaked the cortisol curve is at nighttime. This person is not sleeping at all and is waking up tired and dependent on coffee or dependent on stimulants. And in the top right, that danger zone, this is someone who has been dealing with stress for long term, right? Shorter term. The graph on the left is long term exhaustion. This is what my burnout people look like. Is that you? My programs get down to the core so that you know exactly what you're doing, where you're going, and how to get there. There's no guessing. You can book your appointment with me online 24/7. You don't have to wait until I'm open Monday through Friday, 9 to 5. You can do this immediately after you finish watching this. But the programs are more effective than your individual visits. But I have you just start where you are. We start with an initial consultation, and this can give you a really clear sense about what's been going on. For some people, that's enough. Just to know that you're not crazy and to know that there is something that's at the root of what you've been experiencing. Here's your chance. Go to my website, drverasingleton.com, and I have a tremendous offer through the end of January, $100 off your initial consult. You can't beat that. Now, number 6, your vision. Your way that you're going to move forward is just muddy. And sometimes it feels like, that's a little fun. I could stay here. Feels nice to be in inertia. But I'm telling you, if you want to move forward with lightness and quickness, right? There's no way that you can stay stuck in the mud. It's cold, it's wet. And sometimes we just need someone to put out a helping hand for us. And that's where I come in to help. Number 7, lack of belief in yourself. That you don't think that you can do it, that you don't think that it's possible for you to have a pain-free body, for you to be feeling balanced, and for you to be feeling healthy, the most optimal version of you, right? Sometimes we just need permission to feel healthy. Yeah, it's okay. It's absolutely okay for you to stop drinking coffee or for you to stop taking those painkillers because you're eating the wrong foods and that's giving you inflammation. It's okay to do that. And now is the time to set these beliefs in motion that are going to bring success for you and not sabotage you. Because sometimes you just need to take the first step. But first, you got to believe in yourself. So this is a time, no other time. I mean, what we've experienced in the past year has been unprecedented. And our bodies are just now starting to feel the pain. The emotional eating, the stress eating, the lack of sleep. There's a lot of things that went on last year. Maybe some of us are not yet fully recovered, but in order to really move forward, this is the time to do that. Get the kind of diagnostic testing that you need. Get clear on what nutrients your body is asking for. Have a vision. Move powerfully. Move forward in your life and have a clear vision about what it looks like for you to walk in your body with ease and lightness and with joy. Thanks again for watching. I'm Dr. Vera Singleton. And think about it. What program is right for you? Don't wait. This consultation offer for $100 off is definitely something that I don't do. So take advantage of this. Like I said, now is the time. And I'm giving you permission to take the first step.